Hi, my name is Stephanie Alexander, and this is my first physical assessment video for APN 624. I'm going to start with the comprehensive health history first. Hi, my name is Stephanie. I'm going to be the nurse practitioner taking care of you today. Can you tell me your name and birthday?
Missy, September 21st, 1956.
Okay, hi Missy. How are you doing today?
Fine.
What brings you into the office today?
I've been having trouble with my knees. They're stiff and they hurt when I walk sometimes.
Okay, on a scale of 0 to 10, how would you rate that pain?
About a 7.
Okay, and how would you describe the pain to me?
It's a stiffness and a soreness.
Stiff and sore. Does it happen at any certain time of the day?
Whenever I've sat still or laid down for a long period of time and stand up, they're real stiff and they ache when I walk.
How long does that stiffness and aching last after you've been sitting?
It lasts until I'm up and around for a little while.
So it resolves after several minutes of being up and moving around?
It gets better. It doesn't go completely away.
Okay. Do you take any medications to help with that pain or discomfort?
No.
No? Okay. What other medications do you take at home?
I take Januvia and Metformin, Venicar, Lexapro, Protonix, and Fenofibrate.
Okay, and are you allergic to anything?
Penicillin.
Okay. Do you use any tobacco products at all?
No, none.
Any vaping?
No.
Do you use any illegal drugs?
No.
Okay. How would you, or do you drink any alcohol?
No.
Okay. How would you describe your general health status overall?
I guess fair for someone in my age.
Okay. Thinking about your past medical history, what childhood illnesses did you have?
I had chicken pox and I had measles.
Okay, and then your adult health history, what health problems are you dealing with now?
I've got diabetes and hypertension and high blood pressure, acid reflux, and I have some anxiety.
Okay. Have you had any surgeries in the past?
Just a C-section.
Okay, and how many pregnancies have you had? Just the one?
Yes.
Okay, so you have one living child?
Yes.
Okay. How about your menstrual history? Are you still having periods?
No, I stopped in my 50s.
Okay, and how long do you feel like the menopause lasted for you?
A couple years.
Okay. So you mentioned you have some anxiety. Have you ever been hospitalized for any type of psychiatric illness such as anxiety or depression?
No.
No? Okay. Moving on to immunizations. Do you remember what childhood immunizations you received?
I just remember mumps and measles.
Probably the MMR, the measles, mumps, and rubella.
Yeah.
Okay. Have you had a flu shot this season?
Yes.
Have you ever had a pneumonia vaccine?
No.
And how about the COVID vaccine?
No.
Okay. As far as health screening tests, you have high cholesterol, so I'm assuming you get that checked regularly.
Yeah.
When did you have that checked last?
About 6 months ago.
Okay, and when was your last pap smear?
That's been about 3 years ago.
Okay, and last mammogram?
About 1.5 years.
Okay. Have you ever had a colonoscopy?
No.
And have you ever had your stool checked for occult blood?
No.
Okay. When was your last physical by a physician or nurse practitioner?
It's been 2 to 3 years.
Okay, and when were you at the dentist last?
A couple years.
Okay. Have you had your vision checked recently?
About 6 months ago.
Okay, and are those glasses that you wear all the time or just
reading?
Like reading glasses? Okay. And have you had your hearing checked recently?
Within the last year.
Okay. As far as your family health history goes, do you have any major diseases like in your grandparents, your parents, any siblings, your children or grandchildren? So we'll kind of start with your grandparents. Are they all deceased?
Yes.
Okay. Any major illnesses in any of your grandparents?
Both of my grandfathers died of cancer.
Okay.
My one grandma had multiple sclerosis, and my other grandma died before I was born.
Which grandmother died before you were born?
My dad's side.
Your dad's side, okay. And then are your parents still living?
My mom,
Okay, and how old was your father when he passed away?
41.
Do you know the cause of death?
Heart,
Okay. Does your mother have any major medical problems?
no.
And you said she's how old?
93.
93. Okay, that's pretty good for 93. Your child, does your child have any health problems?
She has hypertension and arthritis.
Okay, and then do you have any grandchildren?
1.
Okay, does she have any health problems?
No.
Okay. I'm just going to run through a list here of kind of big diseases, and you can let me know who, if anyone, in your family has had these. Anybody have hypertension?
My brother did.
Coronary artery disease?
I guess my brother did.
Okay. High cholesterol?
My brother.
Anyone have a stroke?
No.
Anyone diabetic?
Just me.
Okay. Any thyroid disease?
No.
Kidney disease?
No.
Any arthritis?
My mom has a little arthritis.
Okay. Anyone diagnosed with tuberculosis, asthma, COPD, any kind of lung issue?
No.
Okay. Anyone have a seizure disorder?
No.
Any mental illnesses?
No.
Suicide?
No.
Okay. Any substance abuse problems?
No.
Anybody have any major allergies to be aware of to medications?
No.
Okay. Anyone have cancer?
Just my grandfather's
Your
did.
grandfather? Do you have any idea how old he was when he was diagnosed with that?
No, he died in his 70s.
Okay. Any obesity in the family
No.
or any sickle cell anemia?
No.
Okay. Next, we're going to move on to your social history. Are you married or single?
Single.
You're single? Okay. Who do you live with? Do you live by yourself?
Yes.
Okay. What kind of interests or hobbies do you have?
I like to read or shop.
Shopping's good. That one gets me in trouble sometimes. As far as your like social support, do you feel like you have family members or friends who are there to help you when you need it?
Yes.
Okay. How about your style of coping? You know, when something upsetting happens, do you feel like you have good coping skills or that they could be a little bit better?
They could probably be better. I cry if I get really stressed.
Okay. Probably partially comes from the anxiety that you have. Let's see, who do you live with right now? Do you live by yourself?
Yes.
Yes. Okay. What was the last year of schooling you completed?
In high school, senior year.
Okay. Do you have any short-term or long-term stressors in your life that you could identify? Anything on a regular basis that causes you stress?
Well, putting my mom in the nursing home caused me stress.
Okay, and when was that?
That's been a little over a year ago.
I'm sure that's been difficult with COVID, not being able to see her as much. Are you able to talk to her frequently?
Every day.
Okay. So how about any big life experiences? Have you been in the military? Are you retired?
No.
Anything like that?
No.
Okay. Any recent changes in your job history?
No.
Okay. How about religious affiliation? Are you affiliated with a church?
Yes.
Okay. Next will be lifestyle habits. Do you exercise?
Used to walk until COVID.
Okay. And how about your diet? Do you have any dietary restrictions that you follow?
Carbs because of the diabetes.
So you watch your carbs. How many carbs do you try to stick to for each meal?
I try to stick to 45 to 50.
Okay, that's good. Do you drink caffeine?
Yes.
How much caffeine do you drink a day?
2 or 3 cups of coffee in the morning and then 1 or 2 diet drinks throughout the day.
Okay. Basic safety measures. Do you wear a seatbelt in the car?
Yes.
Do you use your cell phone while driving?
No.
Do you use sunblock when you're outside?
Yeah.
And do you have smoke detectors in your home?
Yeah.
Okay, good. Next, we're just going to do a basic review of systems. So I'm going to kind of run through all of the body systems and ask you if you have any symptoms related to those. You could just say yes or no. Have you had any weight changes recently?
No.
Any fatigue?
No.
Fever, chills, or night sweats?
No.
And how would you say your overall energy level is?
It's pretty good.
Okay. Thinking about your skin, do you have any rashes, bruising, Any bleeding?
No.
Any skin discoloration or moles?
No. I've got a couple moles, but they haven't changed.
Okay. How about vision changes? Have you had any vision changes recently?
No.
Okay. And you say you only wear those glasses for reading, so you don't need glasses for normal everyday?
No.
Okay. Have you had any blurred vision?
No.
Any ear pain, hearing loss, or ringing in the ears?
No.
Any sinus problems, difficulty swallowing?
No.
Any nosebleeds or postnasal drip?
No.
Any dental or gum disease?
I've got receding gum in the front.
Okay. Do they ever bleed?
No.
Okay. How about sore throat or a hoarseness to your voice?
No.
Okay. Do you perform self-breast exams?
Not like I should.
Okay. When do you think the last one was done?
The self one?
Yeah.
That's probably been a year or so ago.
Okay. It's important to do those just for to check for any lumps or bumps or changes. The last time you did one, did you notice anything different?
No.
Okay. Thinking about your lungs, do you have any cough, shortness of breath, any wheezing?
No.
None of that? Okay. Any chest pain, palpitations, difficulty breathing?
No.
Do you have any swelling in your legs, ankles, feet?
Sometimes my ankles, they get stiff like my knees.
Okay. How about your belly? Any abdominal pain?
No.
Nausea, vomiting, diarrhea,
No.
constipation?
No.
Do you have trouble with hemorrhoids?
No.
Any eating troubles?
No.
Ever notice any black tarry stools?
No.
Ever been diagnosed with stomach ulcers?
Nope.
Okay. And no hepatitis?
No.
Okay. Do you have any urinary frequency or any burning when you urinate?
No.
Have you noticed any changes in your urine color?
No.
Okay. You said that you're postmenopausal. Do you feel like you have now, or have you ever had in the past any STDs?
No.
Okay. How about back pain? Do you have any back pain?
No, not really.
Okay, so other than your knees and ankles, any other joint stiffness or pain?
No.
And you mentioned swelling to your ankles. Any other swelling in any other joints?
Not that I know of.
Have you ever fractured a bone?
Nope.
Okay. Any osteoporosis that you know of?
No.
Have you ever had a bone density exam?
No.
Okay. So you did mention you have some anxiety. Do you ever have difficulty sleeping?
No.
Any depression? Any thoughts of hurting yourself or someone else?
No.
Okay. Have you ever had a seizure?
Nope.
Do you ever notice any paralysis, weakness, numbness, or tingling in any parts of your body?
No.
And do you ever feel like you're going to black out or pass out?
No.
Okay. Have you ever had a blood transfusion?
No.
And have you ever been tested for HIV?
No.
Okay. Have you noticed any swollen glands anywhere in your neck, armpits, glowing? No. Okay. Any increased hunger or thirst?
No.
And do you have any heat or cold intolerance?
No.
Okay. So the next few questions are just about how you feel like you could perform your activities of daily living, or what we call them. So are you able to eat, cook your own food, go grocery shopping, do your own laundry, clean the house?
I do all that myself.
All of that yourself. Okay. So next we're going to do the mini mental cognitive exam, just to check your cognitive function. Can you tell me what the date is today?
It's the 22nd of February.
What year?
2021.
Okay, and what season is it?
Winter.
Okay, and where are we right now?
Home.
What state are we in?
Indiana.
What city?
Evansville.
And what county?
Vanderburgh.
Good. Okay, I'm going to name 3 unrelated objects, and then I'm going to have you repeat them back to me, and I'm going to ask them again of you here in a few minutes. Say pen, table, and shoe.
Okay. Pen, table, and shoe.
Okay. Now, could you spell the word world backwards for me?
DLROW.
Okay. I'm going to show you 2 objects and just have you name them for me. What is this?
Pen.
Okay. And what is this?
Stethoscope.
Good. Okay. Repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Okay, and then can you rename the 3 things I told you earlier?
Pin, picture, and shoe.
Okay. Next, I'm going to have you take this piece of paper in your right hand. I want you to fold it in half and then put it on the floor. Okay, good. Now I would like for you to read this and then do what it says.
And close your eyes.
Okay, good. And next, we'll just use this piece of paper down here, and I'm going to have you write just a brief sentence. It can be about anything. Just write 1 complete sentence for me. Okay, good. The dog ran down the stairs. That's a good one. Okay, and then I'm going to have you draw this picture for me, these overlapping shapes here.
Okay.
Okay, good job. Okay, next we are going to move on to the physical assessment part of the exam. So first I'm going to look at your hair, skin, and nails. So I'm first just going to assess your hair for any areas of baldness. I'm checking the density and the texture of your hair. Then I'm going to look at your skin. I'm looking for pink, warm, dry skin. Any cyanosis of the skin would indicate a lack of oxygenation, and yellowing of the skin would indicate a liver disease. Next, I'm going to check capillary refill by squeezing the nail. You want a capillary refill of less than or equal to 3 seconds. I'm also going to check the nails for any pitting or clubbing. Next, I'm going to check skin turgor by pinching up an area of skin near the clavicle and watching for quick elastic rebound of the skin. Also, as part of the skin assessment, you would look over the entire skin looking for any moles or lesions that might be new, irregularly shaped, or discolored in any way. Next, for the head assessment, I'm going to look at the scalp, and I'm going to start with palpation, and I'm going to palpate for any lesions or ulcers. Then I'm going to palpate the temporal arteries and auscultate them as well. Okay. Next, I'm going to palpate the sinuses, checking for any tenderness or pain as I'm pushing on the sinuses. Any pain or tenderness?
No.
I'm going to palpate the temporal mandibular joint. I'm going to have you open and close your mouth, and I'm checking for any popping or clicking. I do not feel anything. Next, I'm going to check the lymphatic chains while I am palpating. I'm going to first palpate the preauricular chain, the parotid chain, and the tonsillar chain. And I'm going to check the submandibular and submental lymph nodes. Next, I'm checking the postauricular and the occipital lymph nodes, followed by the superficial cervical chain, the deep cervical chain, and the supraclavicular chain. Next, I'm going to move on to the eyes. So first I'm going to inspect the eyebrows and eyelashes for hair distribution. Then I'm going to palpate the orbital area to check for any abnormalities there. Next, I'm going to inspect the conjunctiva. I'm looking for pink, moist conjunctiva and looking at the sclera for a white or bluish white color. Yellowing of the sclera would indicate an issue with the liver. Next, I'm going to test pupillary reflex to light. So I'm going to have you look straight ahead. I'm going to shine the light in your right eye, checking for a direct response, and then in the left eye, checking the right eye for a consensual response. Next, I will also check the lacrimal glands, looking for any sign of obstruction or any excessive tearing. After that, I'm going to use my ophthalmoscope to look into the eye. Get closer to you. Okay, so you just look straight ahead, okay? I'm going to look into the eye, looking for the red reflex. Then I'm going to look for the yellowish-orange optic disc in the physiologic cup inside of it. I am noting the sharpness of the outline of the optic disc. I'm going to look across the retina at the arteries and veins. The arteries are going to be light red with a smaller diameter. Veins would be brighter red with a larger diameter. As I'm looking at the arteries and veins, I'm looking for any nicking, AV nicking, tapering, or banking. Then I would look across the retina following the arteries and veins, and I would inspect the fovea and the macula that surrounds it. Some eye diseases. If someone has an increased intracranial pressure, you would notice papilledema in the eye where the optic disc would be very swollen to the point where the physiologic cup could not be seen. Superficial retinal hemorrhages occur in people with hypertension, and those look like red flame-shaped streaks in the retina. And then patients with diabetic retinopathy will have tiny pinpoint red dots that are microaneurysms within the retina. Next, I'm going to look at your ears. I'm going to look at the external portion of the ear for any injury or abnormality, and I'm going to look in the external auditory canal to check for any injury before I insert my otoscope. I'm going to pull the pin up and back, and looking for the tympanic membrane, which should be a pearly gray color and have a positive cone of light. Bulging or redness of the tympanic membrane would indicate an ear infection. Next, we're going to do the whisper test to check for hearing. So I'm going to stand a couple feet behind you. I'm going to have you cover your left ear, and I'm going to whisper a series of numbers and letters that you repeat back to me. Can you repeat those back to me?
A3X.
Good job. You can do this twice with both ear, and as long as the patient gets 3 of the 6 letters and numbers correctly, they have normal hearing. Next, we're going to do the Weber test. I'm going to strike my tuning fork and place it on the top of your head, and I want you to tell me if you can hear the sound in both ears the same, or if you can only hear it in one ear or the other.
Both ears the same.
Okay. Next, I'm going to strike it again, and I'm going to place it behind your ear. I want you to tell me when you can no longer hear the sound. Then I'm going to place it next to your ear. You should still be able to hear the sound then, and then tell me a second time when you no longer hear it.
I don't hear it. Don't hear it.
Okay. Air conduction should last longer than bone conduction in normal hearing. Next, I'm going to inspect the nose. I'm going to examine the outside structure for any abnormalities or deformities. Then I'm going to use my otoscope to examine each of the nares of the nose. I'm just checking for any drainage, swelling, or polyps in the nose. Also checking the nasal septum for any deviation, perforation, or inflammation of the nasal septum. Next, I'm going to look at the mouth. First, I'm going to assess the lips for any dryness or cracking. Then I'm going to look inside the mouth, checking the buccal mucosa and tongue for the appropriate moisture and texture. Also going to look at dentition, noting any cavities or any bleeding or receding gums or signs of gingivitis. Lastly, with the mouth, you would want to assess the symmetrical rise and fall of the uvula. So I'm going to have you open your mouth and say ah.
Uh-huh.
One more time.
Ah.
Okay. Normal movement of the uvula would be symmetrical. Asymmetrical movement would indicate an issue with cranial nerves 9 and 10. Let's see. Lastly, I'm going to inspect the neck. First, I'm going to palpate that the trachea is midline. Then I'm going to be feeling for the thyroid gland, checking for any lumps or nodules. I'm going to have you swallow so I can feel the thyroid isthmus move up and down. Then I'm going to stand behind and put my hand on either side of the thyroid, and I'm going to move the trachea from midline so I can feel the glands or the lobes of the thyroid, checking for any nodules and feeling the shape and consistency of both lobes of the thyroid gland. If the thyroid gland felt enlarged, I would listen to it with my stethoscope to hear for a bruit, which would indicate hyperthyroidism. And that concludes my first physical exam video for APN 624. Thank you.